You are live.
Hello, YouTube. Our first live podcast.
It's so funny. Like we're in the podcast studio all the time. And
Mhm.
then, like seeing yourself on Reels or yesterday, finally, and I'm sure yours will come out soon, but Benazati posted. And I was like, oh my goodness, I was like 3 months postpartum.
Oh God.
Chubby face. Okay. Hey, girl. But yeah,
bad.
it just went up. So it's just funny to like see yourself. And actually, I told you earlier, I'm listening to this book, Alter Ego Effect. And it's so true because who we are in our personal lives are just like hanging out even together upstairs is different than you're here because essentially you're performing, right? It's
Mhm.
like
Yes.
on stage, behind the mic, camera, working with clients, right?
Mhm.
It's such a different level of energy that we have to
Yeah.
exert. So
I also feel like all of the reels that I see posted that art posts, I'm like, God, I feel like the camera adds 15 pounds. It is true. I hate it's so hard to constantly see yourself on camera and not be self-critical.
yeah, or like when you're reposting reels
Old
from last
reels.
year, I'm like, what? I'm like at least 40 pounds heavier here. Can we not repost this? And my hair is orange. But hey, listen, we all start somewhere, right? I've been saying this to everyone. Day one, we all have our day one that is repeat. Let's say you've been sick or you've had a baby or whatever the case might be, and you're just going back into work on your physique. You feel like you're starting over. Everybody has a day one. Everybody has a day one starting out with podcasting or creating a
Mhm.
video. The content that we used to make was atrocious and we were orange and our camera was bad, our lighting was bad, all of the things, but we still shut up. And that's the only way that we got here.
I mean, I don't know how I thought it was sustainable to do these like cooking videos where I would like set up lights in my kitchen and like try to create the right angle over food. And it would take me like 2 hours to cook a meal and film it and then edit it. And I was like, also, why do I think that I'm a food blogger now? And this is going horribly.
That's so true because I've been trying to share more recipes. A lot of people are saying we like that. I actually, I haven't shared this even with Art or you yet, but a big goal of mine that's been on my list for this year is I want to redo my Fit Cookery and I want to add a bunch of things. So that's part of why I'm starting to share some of these things. But of course, my plating and my lighting and my picture and stuff, it looks completely different than what a professional or even Art would do that we have in my cookbook. And it looks so gross sometimes when it's on camera, but like for example, last night I made roasted garlic I've been doing a lot of garlic with, oh my gosh, bamboo sprouts. What are those sprouts that we love in pad thai? Bean sprouts, just bean sprouts.
Yes.
So you could just do that olive oil, garlic. It's almost like a little stir fry because that has like that peanut butter flavor to it. Then I put some of this chili oil crunch that I have from Trader Joe's. And I want to take a picture and actually just share with the practitioners because it's such an easy thing. It's so good, but it looked so bad that I was like, okay, I can't share this.
I eat very weird combinations of things and I don't need it to think like you would think this is not palatable, but I don't mind that it's like a huge mess. And so Nick was gone Friday night at some golf event. So I just like made my own dinner and I had a salmon burger and I like mixed it up with mayonnaise and sriracha to have like kind of a homemade sriracha mayonnaise with coconut aminos. And then I think I had roasted potatoes and like some vegetables. So it was like a burger bowl, but a salmon burger with like a coconut aminos sriracha mayo thing. And I was like, my husband would first of all never eat this. And second of all, like, I don't know if many people would think to eat this, but it was really good. And so I'm very into bowls. I've found like they keep popping up on my reels probably because I get drawn to them. But these people make these like delicious looking bowls. So I think I'm going to make a Caesar salad roasted potatoes bowl. It's like some chopped up lettuce, a little bit of Caesar chicken or, salmon or whatever, and then roasted potatoes.
Sounds good.
Yeah. So I saw that on Instagram, but my husband was like, can I just have a Caesar salad? I don't want potatoes in my salad.
So I'm actually I just saw this morning, I did bone broth this week and I found a recipe for French onion meatballs. I'm going to do it with turkey because we're in our cleanse right now, but it calls for a couple cups of bone broth. So I've got that. Okay, cool. I actually have some French onion from Just Ingredients that I haven't used and I need to use it. So I'm like, oh, this could come together beautifully. But sometimes, we wouldn't think of these things. And I'm totally with you. I was at Crate and Barrel and they have this beautiful, it's for like a poke bowl because it has on the top 2 little holes and then your chopsticks go through it. I want 4 of them when we move. I'm like, yes, this is me. I love, I'm all about that bowl life. So
Yes.
anyways, we are here today answering your questions. If you are live with us, let us know, comment below, say hello. Where are you from? We'd love to know. And I feel like there was a lot of rhyming there unintentionally, but we are excited to go through your questions. We obviously field these from our Instagram accounts. If you're part of, the Poop Queen or the Hormone Queen, you can always watch our stories for the Q&A boxes that we put up generally every week, sometimes even twice a week. So we will tag you as we answer some of these as well, but we're going to kick it off with diarrhea because nobody want to be shitting themselves. And we're going to talk about liquid poops. So in all seriousness, this woman reached out to me. Her husband was diagnosed with IBS-D. So if you're not familiar with my philosophy on this, IBS is a BS catch-all diagnosis. Whether or not you're dealing with diarrhea, mixed, or constipation, we want to get to the root cause. So typically that's going to be some level of underlying infection driving inflammation. This can be bacterial imbalances, other types of infections, parasitic infections, H. pylori, mold, mycotoxins, candida, SIBO, the list can go on. And stress on the body. That's kind of like how I say the acronym for this. So first, we know that in conventional medicine, it is important. I believe it's important to get your scopes, to get your colonoscopies, right? You want to make sure that you are, looking for anything that's very serious. But the problem is with GI doctors, at least in my experience, the ones that I've spoken with and worked with a bit, they don't ever look to the liver as far as an issue here. And I had a man, he was in his 70s, very severe case of diarrhea. IBS-D is the diagnosis, and medication wasn't working for him either. And that's what this woman says. What else can we do? The meds don't work. You have to look at what's going on upstream. So for the individual just that I'll share the story with, I worked with, he had pancreatic insufficiency. He did have underlying infections in his GI tract, and he had a lot of liver gallbladder issues. And so being able to support him with extra strength digestive enzymes, he did take the test to his doctor. Doctor agreed, yes, this is very serious. He was taking Creon for a period of time, the pharmaceutical, very, very expensive out of pocket. So we got the job done with extra strength pancreatic enzymes from Metagenics. He was taking 2 a day for a while. That's how insufficient he was. And then he was able to go back to the normal dose of 1. And then all the while we were really working on liver gallbladder. So it's really, really important to consider other outlying factors here, not just what the colonoscopy shows and accepting that diagnosis. The other thing that we would think about is adrenal stress and imbalances here. Our nervous system is constantly responding to things, right? Your brain is always searching for threats and it's responding to something. Some people know this all too well when they get excited or they're nervous, maybe feeling this anxious. They either do one of 2 things. They go to the bathroom a lot or they completely shut down. And so maybe that is, something to consider here that's going on. Obviously, we're going to look to the diet. This is where I would say start low and slow, increasing soluble fiber. I like to think of it this way. Slow. Soluble, slow you down. And so you could do that with, like rice water. Obviously, we can take different types of fiber, brat diet, of course, banana, rice, applesauce, those types of things. But when we're thinking of just soluble fiber sources, applesauce, canned fruit, orange, grapefruit, potatoes, peas, beans, carrots, barley, all those types of things. And then we actually have, and we'll put this in the show notes, it's a liquid poop action plan. One thing I would absolutely put into place is Saccharomyces boulardii. We do that in a lot of cases. This works very well for acute diarrhea. A lot of times when we're looking at infections, things like C. diff are very serious, and this is one that can actually be helpful for that as well. Maybe you have the stomach bug or you've had an antibiotic, right? And you're getting antibiotic-associated diarrhea. SAC-B would be good here too. So all of that is listed in that guide. There's some other things in here, of course, that I would do, but I can't drive home the point enough to say, get blood work done, a comprehensive lab panel, especially when we're looking at eosinophil activation. We've had clients come in where their eosinophils are in the teens or 20s, dealing with a lot of these loose stools and urgency. And the eosinophils, when we look at that, it's a type of white blood cell, should be 3 or below. Can indicate to us either there's a food triggering the immune system that's coming in or some other chemical, or there's a parasitic infection, right? Or other things that we need to work on and, of course, look at comprehensively. So I'm going to leave it at that because I gave you a lot there. Link in the show notes for the liquid poops action plan.
So we're going to jump to one of my questions who was put in by Jenny Apt. At Jenny Apt on Instagram. And I get this question a lot. Extremely heavy periods for my teen. What can I do? So the thing to understand is that teens' hormones are still like under construction. They are, as you are getting into your early 20s, progesterone is still developing and it doesn't fully mature until like mid 20s because consistent ovulation takes years to stabilize after a teen first gets their period. So that means teens are naturally more estrogen dominant because, as we know, hormones are Goldilocks. They need to be in balance. When they are not in balance, you don't necessarily have to have high estrogen, but you can feel like you're estrogen dominant because progesterone is not balancing it. And so progesterone is what kind of calms and stabilizes estrogen. So when it's lower and consistent, estrogen can feel a lot stronger. And on top of that, when you layer in kind of the changes that I would say have happened probably over the past, I don't know, couple of decades, teens today are under a lot more metabolic stress. So they're having a lot more blood sugar dysregulation. A lot of them are potentially under eating because of social media and just this, feel to have the perfect body and appear perfect and all of that. Chronic stress can blunt ovulation signaling in the brain. And so when there's no ovulation, it basically equates to low estrogen and stronger estrogen. Low progesterone and stronger estrogen dominance. And then on top of that, we also think inflammation and histamine. Estrogen increases what's known as mast cell activation, and COVID made this a heck of a problem. COVID in particular kind of destabilized mast cells for a lot of people. And so we're seeing a much larger scale of mast cell and histamine issues since the COVID explosion. So I think that that is also playing a role because then histamine feeds back and raises estrogen activity even more. And this loop will worsen all estrogen dominant symptoms. So think cramps and heavy periods and acne and headaches and anxiety. And then the xenoestrogen exposure, like plastics, fragrances, pesticides, receipts, skincare, right? Like all of these different endocrine disrupting chemicals that bind to estrogen receptors and they don't show up on labs. So like you don't know that you have extremely high estrogen feels other than your symptoms because the labs look normal. And so xenoestrogens, I think, are a huge piece because, again, very prominent right now. And so with teens dealing with developing progesterone on top of inflammation, the increase in insulin resistance and obesity for younger kids and teens is severely raising. So that is going to make things worse as well. And it's, I think, why symptoms are probably a lot stronger than they were, a couple decades ago. I remember having cramps and needing a heating pad. And like, yes, there were some days that I didn't want to go to school because the cramps were pretty bad. But I talk to people that their teens are vomiting, they're having like debilitating emotions and, cramps and bleeding through large tampons in an hour. Like that should not be happening. And that's where you kind of have to evaluate beyond just the hormones. And so some things that can help: fiber. I know it's a lot to ask a teen, but fiber helps to bind and it helps to clear estrogen from the gut. So fiber in terms of like a smoothie, put a smoothie together for your teen. My love smoothies, so I plan on hopefully keeping them in there. Putting in some fruit, berries are great for this, some spinach, some things that are going to help with raising fiber for that child. I love Metapure too, or you can do something like Hormone Plus Complete, even though the flavor is disgusting. I love the product. I wish they made a different flavor than chai, but you can use something that's going to help with some of the estrogen and detoxification aspect of it. Estro Factors. I love this product. It provides sulforaphane, which is a great antioxidant. It provides DIM, which helps with estrogen detoxification. It provides polyphenols that support liver detox pathways, especially phase 2 for safer estrogen metabolism. And you only have to take it the second half of your cycle. Quercetin. So quercetin or vitamin C, I find quercetin's a little bit more potent, can act as a mast cell stabilizer. It helps to lower histamine and inflammation. Some people don't tolerate it. It's, you kind of know when you don't tolerate it, but in general, I find that it can be very helpful for teens. And then magnesium, higher dose. So bringing in magnesium in the second half of the cycle, you can dose upwards of 5 milligrams per pound of body weight, or higher potentially. You just have to watch blood pressure. You have to watch, how the person feels. But magnesium overall is very safe and can help a lot with vasodilation and kind of the cramps and pain that can come. It downregulates prostaglandins, which are the inflammatory messengers that happen with periods. So lots of things that you can do. That's kind of like my trio that I put in place for teens. All of them are very safe for teens. And you can essentially treat teens like an adult. Once they're, above the age of 12, 13, you can essentially utilize supplements like they are an adult. So,
Yeah, I would add to that. Metagenics has an amazing product, rapid period relief. I've actually used it a little bit postpartum. I don't need it very much, but it works within like 30 minutes. And I find it like a Midol, honestly, like it
mm,
lasts too. So within this blend that they have, you've got turmeric and boswellia, which is for cramps, back discomfort, head tension. You can also use other things like cramp bark, I believe is one that's just
yeah.
not, as
Yeah.
common. Ginger to reduce fatigue and improve energy. And then it also has saffron green tea and B6 to support the hormone balance and also blood sugar. So that's one that I would keep on hand in terms of just, through the cycle. If they are still having some of those symptoms, clean that up a bit. So we are going to go to a question that I have on my Instagram from Clean and Fit Life. And they are asking, how do you know when you need HRT? If you're in that phase of life with no underlying conditions, is that your only option? And I think this is a great question because right now, BHRT, bioidentical hormone replacement therapy, is getting a lot of buzz because even on the conventional medicine side, they're starting to realize how they really screwed women over for so many years because of the NIH study. And a lot of that's, of course, been debunked. And we're realizing how much hormone deficiency takes an impact. It takes a toll on the woman's life. So, my question back to you would be number one, what are your symptoms, right? Like you're in this phase of life. I'm assuming you're, in some level of perimenopause, where after the age of 35, things start to shift even before then, for some women. But are you having abnormal cycles? Are you having short cycles, then longer cycles? Are you having issues with your, menstrual cycles being shorter or longer, heavier or lighter, right? There would be a lot of things to look at here. And then we know from a hormone perspective, it's not just your period. In fact, that's not even the thing that we really care about the most for a cycling female. We want to look at the main event, which is ovulation, but that's probably not answering your question here. So I think number one is to look at symptoms. Outside of obviously, the period symptoms, everything Becca just talked through as well, we would say, are you sleeping well? Are you at a good body composition? Do you have good digestion? Do you have good energy, mental clarity? Are you lifting and recovering in the gym? Those types of things. So you kind of have to look at the whole health profile because hormones do influence everything. The second thing is, what is your goal? Is your goal to just be, let's say, normal or mediocre here? You just feel okay? Or is your goal to really optimize, right? And thrive? I want to have better energy. I want to have better strength, better stamina, better mood, better libido, all the things, because hormones can truly help when you're in that state of things being deficient. If you bring it back up to baseline to where you feel good, which is very bio individual, can really improve your life and longevity. A lot of research when we're looking at bioidentical hormones, not synthetics from birth control and things like that, but bioidentical, shown to reduce blood clot risk, cancer risk, Alzheimer's, dementia, right? Bone health. Like we have to think about the things that we want to be doing when we're 80, 90, 100 years old. So that would be the second question there to bounce back at you. And then when you say, is that your only option? No, there's other options, of course, right? You can use different herbs. I personally, and Becca can weigh in this too, depending upon where you're at in the seasons of life and answering the two questions I just asked you back. I don't really believe that herbs get people there from an optimization perspective. I think there's a lot of people selling these hormone balancing herbs for $89 a bottle that I think is a bunch of bunk, to be honest with you. Now, on the opposite end of that, there are some that are very helpful. Just like with the teen situation, something like Chase Tree or Vitex to support progesterone, that's supporting the production of progesterone. That could be helpful and viable depending upon your picture. If
Mhm.
you're completely bottomed out with progesterone and you want to optimize, I don't think that's going to be the thing that gets you there, right? But there are herbs that can support that, right? There's other herbs that can support estrogen and testosterone. I have not seen one miracle product, right? There's a bunch of products out there, some that I've used in the past, Fem Essence, all these things that I just don't see, again, from an optimization standpoint, do the job. If you're wanting to be on the conservative side and address things like intravaginal dryness, or maybe you're having UTIs or urinary incontinence, and you just want to support the vaginal tissues and the strength of the tissues, then you can use things over the counter, such as intravaginal suppositories. They have some estriol in them, as well as a little bit of DHEA, kind of depending upon which one you're going with. We have those in our full script account. There's also over the counter low dose progesterone. So Progon B, that comes in a dropper form, You can do that under your tongue. You can do it other parts of your skin. Just be cautious with that. Or Quicksilver makes a progesterone as well. So there's certainly other options. And then I would just refer you back to other podcasts that we've done on HRT, understanding the differences, the types, what we would essentially prioritize, right? So for most women, we're going to prioritize progesterone first. In some cases, progesterone looks great and we're just using testosterone. That's me right now. I've not been able to take progesterone. I actually haven't needed it. But once I got rebalanced postpartum, I still have it if I want because I was having really short cycles. I'm back to like a 26, 28-day cycle. If I do take it, it's very low dose and it's like the week before my period because now Ethan's sleeping through the night. Praise God. I could do that again. But so far, it's just been testosterone for me. And then we would layer in estrogen last. But again, bio individual.
Yeah, I agree. I haven't seen a whole lot. And I think kind of depends on what phase of life you are truly in. Like even today, we were talking with a client with our medical team, and she hasn't had a period in over a year, but you know that the ovaries are still somewhat online at that point, right? Like there is a point later in menopause to where like things fully bottom out. And for some people, that's the best time to bring in hormones because other people are just so sensitive to them to where if you bring a sniff of estrogen in or you bring, a little bit of testosterone and they're an aromatizer, you're going to end up with bloating and breast tenderness and all of these kind of negative side effects. And so I think it's very case dependent. And to be totally honest, hormones are such a Goldilocks situation, person to person. There is no one blanket approach to hormones. It has to be based on that person, which is what makes it so hard and such an art. And the person has to be very in tune with their body and also on top of other things. Like you have to stay on top of your health and your exercise and your nutrition and all these other pieces because hormones are influencers. We always talk about that, and they're going to influence the environment they're inside of. And sometimes that's not for the better if the environment's not doing great. So, yeah, I think a lot of it is based off symptoms. You can use blood work to evaluate the rest of the environment, but I honestly don't put a whole lot of weight on hormone blood work when someone is on HRT or if someone's considering going on it. I take it into account, but it is by far not the first thing that I'm like, oh, because of this, we need to increase this. It's how are you feeling? And yes, there is research on estradiol and needing a certain estradiol level for bone density and preventing osteoporosis and potentially growing bone later on in life, which is possible. But again, I think it comes down to the person.
Yeah. All right. You want to take the next one?
Yep. Let's go. So the next one is around hair loss. I got a lot of questions about hair loss lately. So this is from at Megan Craftston 103. Hair continues to fall out despite blood work looking good. I'm working with a functional doctor. So hair loss continuing despite good labs is actually very common. And this is because I think this is very important to understand. It usually means that the issue isn't showing up in standard blood markers yet, or the problem is happening at the follicle level. So hair follicles are metabolically active, they are hormone sensitive, and they are stress responsive. They behave more like a mini organ versus like some passive tissue, okay? So some reasons why blood work might miss it. Blood work shows what is circulating. It is not what is happening inside the follicle. Again, think of your follicles as like these own little mini organs, okay? So hair loss is influenced by local hormone conversion, especially DHT inside the scalp. So many people talk about running DHT. You can, but rarely do I see DHT elevated in people that struggle with DHT-related hair loss, which is why I like doing a Dutch test for that, because you'll see more at the urine metabolite level. And so I don't love running DHT. I just don't find it very helpful in a lot of cases, but you also have to evaluate nutrient delivery at the follicle, inflammation and oxidative stress, cortisol signaling, blood flow is huge, and mitochondrial function. So you can have normal blood hormones, but excessive androgen activity at the follicle level. I've seen women with low testosterone, low androgens, but high DHT activity at the follicle level and losing hair. And so understand that it does not have to be what is on blood work. Normal iron, but there's poor delivery or utilization. Normal thyroid, but there's low cellular T3 signaling. You can have normal thyroid levels, but your tissues aren't experiencing them. So again, you cannot just put all your weight on blood work because blood work can look good, but the follicle can still be under stress. So the thing is, you do still want to run labs because there might be very obvious clues. And if you are running labs, I would recommend running ferritin. You need ferritin between about a 60 to a 90 ideally for hair. Iron, total iron band total iron binding capacity and total iron binding saturation. Low normal ferritin is probably one of the most common missed causes I see. Thyroid, you need TSH, free T4, free T3, reverse T3, antibodies, because hair needs strong T3 signaling at the follicle. Cortisol, AM cortisol, or blood or saliva. Saliva is probably the best, to be honest. Not everyone can get that or don't want to get that. So at least get like a blood cortisol. Sex hormones, total binding globulin, estradiol, and progesterone. You can run DHT, but I don't always see it correlate. I like Dutch. I think that Dutch is helpful because it gives you the cortisol rhythm, not just in a lot of cases pretty accurate. Androgen metabolism. So alpha versus beta pathways for androgen. More 5-alpha dominant, they're likely more to have hair loss related to androgens. Estrogen detox pathways, progesterone sufficiency, and it helps identify kind of like stress-driven telogen effluvium or androgen-driven follicle maturization. Wow, miniaturization. Estrogen and progesterone imbalance, because that can also impair growth signaling. So hair is very sensitive. I like running more an HTMA if you can't figure things out, or looking at like a Cyrex or vital nutrient panel, because hair is very like tissue sensitive to minerals. You a lot of times will miss that on labs. You're not going to see a true like zinc copper imbalance on labs. You're just going to see a serum level. You're not going to see it like a tissue level. Potassium and sodium are really important. Calcium dominance can slow metabolic activity, poor magnesium utilization. So it's a very mineral dependent tissue. Looking at the pattern is big, right? So diffuse shedding all over is typically more stress driven. Cortisol dysregulation, nutrient depletion, sometimes illness, post-illness. It happens a lot of times post-COVID. We'll see it happen a lot of time postpartum, obviously. Caloric restriction constantly. The temple and the crown, so more on the temples, the hairline, and then the hair part is typically more androgen based. We see this a lot more with perimenopause because testosterone and androgens become more dominant comparatively to estrogen and progesterone. And so we see that a lot with low progesterone protection. Hair not regrowing. This is usually thyroid, iron, and mitochondria. The eyebrow thinning is a lot of times thyroid. And dry, brittle hair, I also see thyroid, poor protein utilization. So think gut related. So like your body's not utilizing amino acids, poor zinc and copper balance, essential fatty acids are not being used. So hair loss is usually a lagging indicator too, in most cases. I have seen it be very reactive to certain things, but in most cases, it's 2 to 4 months ago. So like if you went through a gut protocol and then 2 months later, your hair is falling out, that is usually more of a shedding reaction that is not necessarily something we need to worry about as long as it's not excessive, right? So you need to kind of think about, if I'm having a lot of diffuse shedding, like the stress, what happened 2 to 4 months ago? So that's something else that I always evaluate. And again, you have to think not just blood work, because blood work a lot of times is not going to show you why you're losing hair. You have to look a little bit deeper at the tissue level, what pattern it is, all of that stuff. And so options in the meantime, I would say if it's more androgenic hair loss, I do like spironolactone. I think it can be very helpful. It's a pretty harmless medication. Nattokinase is great for microcirculation and blood flow. Topical estradiol cream we have seen be very helpful for hair growth. And then I'll let you cover the rest because I know you have a lot of these that you've used too.
Yeah. I mean, I can't say enough good things about the intracellular nutrient test. I had a young guy, I think like 20, 22, crazy hair loss case. And people would think that it's, something to do with copper being elevated, but he was actually very depleted. And so when we were able to go through that, not only did we stop the hair loss, we're getting off finasteride and those types of things, some of those harsh medications, we were able to restore a lot of his mineral balance. He's got great energy. His hair is regrowing. It looks awesome. And one of the products that we have put in, actually 2 that I'm going to mention, we used for him and he was like, oh, this is amazing, is the Oliveda shampoo and also their hair and scalp treatment. I love the hair and scalp treatment because it smells just delightful, but it also works really well for just nourishing your scalp. If you are dry, flaky, let's say you have a little bit of that dermatitis, dandruff type picture. He had struggled with that too for like 15 years and that cleared it up. My husband's used it, cleared it up. Ethan, I used it for him, a lot of clients, and nothing but amazing things to say. And they're pretty affordable as well. Another one that we used was a topical serum. It's a topical peptide from Infinywell. We can put the link in the show notes for you, but it's called PTD DBM hair restoration and growth. And so topically, you can apply that, depending upon what your pattern is. And then I would take it a step further if you're comfortable doing this. If it is, definitely like a specific area that it's a large spot, use like a microneedling thing at home because that will help get the serum into your skin even deeper. And then I have seen some clients use Mary Ruth multivitamin with hair growth, and that's worked well. I know Becca had on here Nutrafol. I just can't speak to it. I mean, some people, I think it's like a hit or miss product, right?
Mhm.
And that is the hard part with hair loss. It is hit or miss with some people, right?
Mhm.
So going back to even like the case that I just mentioned, he didn't do well with another peptide from Wizard Sciences, but his mom loves it, right? So it
Mhm.
just kind of depends upon the whole case there. All right, last question we are going to round out today with, and I think this is a really good one and a lot that we're going to deep dive here on blood pressure. So, Katie Newland, 21, says how to lower or how to support lowering diastolic blood pressure. Top number is fine, but bottom number is high. So, first, what is this? Okay, when we're thinking about this scenario here where the bottom number is high, this generally points to constant vessel tension. So it's not a blockage, but things like stress, inflammation, or sleep, insulin resistance, and mineral imbalance can really impact this. So your body is just never fully letting go. I would also say genetically, we'd want to look at like a NOS2 block here. That would be something that would tell us a little bit more about your circulation and constriction and all that. So the big levers that we would look at, obviously, some of this is going to be what you've heard in terms of blood pressure overall, but daily movement, get that blood flow going. Those who move daily almost always lower that diastolic blood pressure number. So this could be walking, cycling, swimming, get your heart rate up. Obviously, watch how you're responding because if you are somebody who's not really handling stress well right now, your resilience is low, then you wouldn't want to be doing something like high intensity interval training or very stressful workouts. You could just do something simple like air squats or 10 to 15-minute walk after meals, exercise snacks, right? Weight management. I don't believe that you are overweight, but definitely thinking here if you are struggling with this inflammation, insulin resistance, and how that is going to impact, your vascularity essentially. Stress reduction, non-negotiable. We talk about this all the time. We sound like a broken record here, but the diastolic blood pressure is tightly linked to that sympathetic nervous system overdrive. So you're stuck in that freeze, fight, flight, or freeze, really wanting to support getting into that parasympathetic rest and digest, nasal breathing, yoga, laying on the floor in silence and just turning the lights off and focus on your breathing and your breath work and getting out all of the thoughts. Sunlight and grounding can be great here too. Get your bare feet in the grass. Sleep, you got to make sure that you're sleeping well. When you're looking at diet, obviously we want to have high anti-inflammatory, good omega-3s, things that are going to be very helpful to lowering inflammation. Thinking also about antioxidants, a lot of colors, vegetables, those types of things. Mediterranean diet has been shown in the research to lower that number by about 5 to 8, which is pretty good. This is where we're going to think about adrenal function as well. So maybe lowering your sodium, but increasing your potassium. More and more, we're seeing this with people that if you have these heart palpitations or this kind of feeling of anxiety, while sodium is important, we want to not leave out potassium. It's just as important. So maybe go to a 2 to 1 or 3 to 1 potassium to sodium ratio. If you've not tried that, you can use things like coconut water, cream of tartar, very simply, or you can buy things like Keto 1000 or just electrolytes that are higher in potassium. And then when we think beyond this, we're going to look at your thyroid function. Suboptimal thyroid function can increase that vascular resistance or elevate that diastolic pressure. Again, normal doesn't always mean optimal, right? Join us next week for our 5-day webinar series. We're going to break all of that down for you. Further, you want to look at other inflammatory markers, right? So you could be fit, you could be not overweight and in a really good shape overall, but we look at your labs and your ferritin is too high, your homocysteine is high, and your HSCRP is high, all flagging some cardiovascular inflammation. Inflamed vessels don't relax well, right? Blood pressure and insulin, or sorry, blood sugar and insulin, excuse me, that's going to impact, how your arteries are stiffening. Even if your glucose looks fine, we want to look at, especially in the age of 35 to 60, what your fasting insulin is. And then other supplements that you could use here to support and then monitor, obviously, anything that you're doing. This is not medical advice, but things like magnesium glycinate or taurate to support vascular relaxation and muscle contraction, all of that. Garlic extract actually can help improve endothelial function. And then again, anti-inflammatory support. So here's where you could go with like omega-3s. Always give the caveat that if you have histamine issues, I wouldn't be using a fish oil. Instead, I would using a specialized pro-resolving mediator that is an SPM. So SPMs do not have that impact on histamine as much as maybe some omegas. Plus omegas, unless you're getting a really good brand that can be expensive, you just want to be cautious because you don't want to take rancid fish oil. So all of those things can be very supportive to the system. And then I think like anything, it's really just taking an evaluation of what's working well for you. So try one thing at a time. If you're going to add potassium, watch your numbers. Then if you're going to add magnesium, watch your numbers and so forth.
Yeah, absolutely. Potassium, too high of potassium can also be dangerous. So you do need to I always say start low and slow. If you haven't tried higher potassium, like maybe even 1-to-1 potassium to sodium ratio, because too much potassium can also actually cause heart palpitations and tremors and things like that. So again, always a balance. That's always why we say slowly implement things, analyze, evaluate, and then go from there, because not everyone can handle major changes at once. Very few people can. So hopefully you liked the live Q&A. Was anyone on YouTube, Art?
Yeah.
Oh, look at that.
Hi, where are you from? Do we have any questions in the chat?
No, they're not right now. They were there.
Oh, they
okay.
were there. Okay.
Okay.
We did go long.
Yes.
We'll try to keep these and cut these down a little bit more.
Maybe
but
like 15, 20 minutes.
if you're watching, just remember next week, January 19th, all the way through Monday through Friday, we're doing Lunch and Learns. It's our free 5-day webinar series all about labs decoded, literally helping you understand your labs in English, what they mean, decoding them, because nobody understands what a bunch of numbers on a sheet with a bunch of letters means until we really break it down for you and explain each marker and what it can indicate. So we hope to see you there. And with that, have a fantastic Tuesday and a great rest of your week. All right, can we bang like